Good evening, everyone. I kind of been hesitant on doing this whip and chat, but I did a live earlier and some things have been on my mind that I wanted to talk about, but I didn't want to talk about them in a live because it's kind of, I don't know, not as able to be as reflective, I guess. My roommate's in bed, which is why I'm kind of quiet right now, so I apologize if you can't hear me. I'll try to be as loud as I can without waking her up, because she hasn't slept well the last couple nights. But it is the middle of the night. This tends to be when I start thinking about mental health, but I've been thinking about mental health for the last few days. And today, it just really was on my mind. I was at the cancer clinic with my mom, and I was talking to this stranger, and she used to work at one of the inpatient facilities near here, and we were just discussing a variety of topics, just meds and treatments and diagnoses and just how broken the system is. And maybe you've never thought about it. Maybe you've been fortunate enough to never have to go inpatient. And if that's the case, then congratulations. That is a blessing. For me, it's been almost a year since I went inpatient, but in the last 9 years, 10, it's been 10 since my first admission. 09 was my first admission. In the last 10 years, I've had over 25 admissions. 3 of them were to the state hospital, and that is not a pleasant place. I know I've said that in previous videos, but talking with this lady today just brought back so many memories, and most of them weren't pleasant. I apologize if you feel I overshare in this video, but I'm simply sharing my experiences and what my experiences with my mental health has been like. Some of them are not the most pleasant. You'll understand what I mean. Obviously, none of them are vulgar. None of them are explicit. Just none. They're not always socially acceptable, I think is how I want to phrase it. So let me start with the first. The very first time I went to the state hospital, they put me in a room. They had rearranged rooms to put me in this room, so I didn't think anything of it because it was the room right next to the nurse's station. And it's like, okay. And I was scared. I was a 21-year-old female. I had never been in a psych facility before this time, and now I was in a state hospital. And you see all the horror stories on TV and all the movies about what mental asylums used to be like, and you can't help but wonder, is that what they're still like? Well, they're mostly not. So I get put in this room, and the very first night, I'm trying to sleep. It's not going well because it's a 3-bed room, so that means there's 2 other people in there with me. And the woman in the bed across from me sits up at like 2 a.m. and starts screaming that the Mormons are the children of Satan. Now, that is my religion, Latter-day Saint. And Mormon's just a nickname for it, in case you weren't aware. So it's like, okay, this is a little scary, but I think I can deal. I just won't let her see my Book of Mormon. Night number 2 comes along. She sits up in the middle of the night, probably about 3 a.m., starts screaming at the top of her lungs to the point where they have to bring in a shot to sedate her, that the Mormons are going to chop off her head and offer her up as a sacrifice to their god. Okay, that was it. I'd had enough. I was convinced this woman was going to kill me if she found out I was a Mormon. So I went out and I was like, you gotta move me. I can't sleep in there. And they're like, oh, you'll be fine. I'm like, no, she's gonna kill me. So they're like, well, we can't do anything tonight. Talk to the social worker in the morning and we'll see what we can do. So I did. I talked to the social worker who talked to the psychiatrist, and they had me out of that room within a couple hours. I found out later on that the nurses knew what religion I was before I got to the hospital. They put me in that room on purpose to see how I'd react and how she'd react, which I think was completely unprofessional, because you don't throw two mental patients who are going to conflict together and see what happens. No, that's not how it works. Another thing this hospital did is, I'm not sure how many of you are familiar with borderline personality disorder. I am diagnosed with it. It's a diagnosis that you are not born with. You develop throughout time. It stems primarily from having gone through traumatic situations as a child, but you can develop it as an adult. I believe I've got my facts correct. Correct me if I'm wrong. But mine comes from abuse. I'm not going to go into detail. That does not need to go on my channel. Anyways, part of the characteristics of borderline is that you're a lot clingy. You're very dependent on others' approval. You basically never really mature past the age of the trauma, is the way I understand it best. So for me, I mature emotionally, I should say. Physically you mature, and in some ways you mature emotionally, but in other ways you don't. So I was very clingy. I tend to catastrophize a lot, which is thinking worst case scenario, which is another characteristic of it. I know we went over this in another video I did, and I apologize for the duplicate information. You'll see why I'm doing this. Anyway, so if you want to know more about it, look at one of my past videos. I don't remember which one. I'll link it in the bottom. Anyway, they put 30 patients with the same diagnosis together. Now, normally that would be okay. Depression, anxiety, not with borderline, because you feed off each other. When you're not emotionally mature and you're dependent on others' approval, when one person goes off, others tend to as well. There were nights when we would have 4 or 5 girls who were on one-to-ones, where they would have one staff assigned to just them because one person's behavior had acted up and it had triggered a chain reaction. There were nights I got woke up at 4 a.m. by people screaming in the hallways. Our unit had no pictures on the wall for the longest time because people would use materials in the pictures to hurt themselves. They took away our piano. All our furniture was bolted to the floor. Yeah. A little bit of that's my fault. I had a tendency in my early days to throw furniture, and I'm not proud of it. But when I was unmedicated and unmanaged, it wasn't pretty. Another thing the state hospital did is severely over-medicate. I am appalled at the amount of medication they had me on at one point. Those of you who are familiar with psychotropic drugs will understand this. Those of you who are not, I apologize for the terms, but I'll try to break it into layman's terms. Most people are familiar with Ativan. I was taking the maximum dosage of 2 milligrams 4 times a day. I was also taking Haldol. I was taking 10 milligrams of it 3 times a day. I was also on Seroquel, which is it's an antidepressant, I believe, but it also makes you very sleepy. I was taking either 600 or 800 milligrams of that twice a day. I was on other meds too, but these were the 3 I could remember. I was basically a zombie. There were days they had to carry me out of my room because I was just so depressed and so tired that I couldn't function. Now, here's the gross part, and I apologize. This is probably too much information, but this is how bad my depression gets when I'm severely, severely depressed. When I was in the state hospital for the 3rd time, and I did not want to be there, I quit showering. In 3 weeks' time, I took 3 showers. And that's only because they took all my bedding to change it and refused to give me any clean bedding until I showered. So I took the quickest showers I think known to mankind. Washed my hair, washed the essential parts, was done. Went back to bed. And that was that. I refused meds. I refused everything. I wasn't eating. I wasn't drinking. I simply wanted to sleep and cry. And that's what I did for 3 weeks. Finally, they got me on a med regimen that was somewhat stable, and I started to improve. But I will never forget that. I think, other than when I've been suicidal, that was the lowest I've ever felt. Let's talk meds. I have a couple med allergies, and the reactions have been interesting, to say the least. Let's start with the mild one. There's 2 that are memorable, and the mild one is Clozaril. Clonidine. No, not Clonidine. Clonidine is something different. I apologize. It's Clozaril. I was taking that. It is believe an antipsychotic. It worked wonderful for me, but it caused me to have a seizure. I was in the hospital for 2 days afterwards. I don't remember them. I don't even remember how I got home from the hospital. I have suspicions, but nobody else remembers either at this point because it's been years, but 2 days in the hospital that I simply do not recall, and I hate that. It's like, where did those 2 days go? The last thing I remember is sitting in a chair talking to my mom, and then I woke up briefly in the ambulance because it was cold, and then I was in a hospital room trying to figure out what had happened because nobody would tell me and I couldn't make words come. If any of you are medical professionals, I strongly urge you, if you've got a patient who's unconscious when they come in the hospital and they wake up, take the time to explain to them what's going on because they're probably scared. They have no clue what's going on, where they are, what's happening, and all these people are around them. It's very frightening. Then the other med is Geodon. That that was a bad med. That was just that was just bad. Um, I'm diagnosed bipolar 3. I said that in my live earlier. Most people only have heard of bipolar 1 and 2. Let me give you a quick synopsis of the two. Bipolar 1, you tend to go into mania more often. The high end. Bipolar 2, you tend to hit the depression end. You don't hit mania as often. You hit what's called hypomania, where you're hyper, but it's more controlled. Bipolar 3 is more where you have you can have hypomania or mania, but you also deal with hallucinations, voices, shadows that you see out of the corner of your eye. It's kind of like schizoaffective disorder, which is a combination of schizophrenia and bipolar, but it's not quite there. So that's what they've diagnosed me as, because I do hear voices when nobody else does. Not just the voices that are around me, I promise. And I hear music sometimes, and I do see shadows out of the corner of my eyes. When things are going bad, if you ever come over to my house, there's blankets tacked up over the windows. Right now there's not, because I'm doing really well. But I have a wonderful roommate who understands that sometimes I just need to put him up, and she lets me, and she doesn't judge me. Anyway, back to the Geodon. That medicine made me hallucinate horribly. The doctor had me on a low dose and it wasn't doing anything, so he doubled my dose without raising it slowly. Within 2 days, I was hallucinating. I was convinced. There's a bridge near my house. It's not a big bridge, but the way down to the water is fenced in, so you can't get down there. And when this happened, the water wasn't exactly at a low point, but I was convinced that there were children in the water, children from my church, and that I had to save them. I was trying to find a way to get down into the water. I was also hallucinating that children from my church were being guillotined. I could see it in front of me, and I was freaking out because of it, because these were the toddlers from my church. And yeah, it wasn't pretty. I was convinced. They did end up hospitalizing me. The police came and got me off the bridge. I had called my roommate, if I'm remembering the right situation. I think this is what it was. I had called my roommate and I refused to come home. So she called the police and they used the tracker on my phone to find me, which I appreciate now because I'm glad they did, but it's still kind of creepy that the police can find you anywhere by your phone. Just a little creepy. But I'm glad they did, because I'm glad I'm here, because I don't think I would have made it if I'd gotten in that water. I was convinced when they hospitalized me that the nurses were drugging my food, so I was only eating plain salad, no dressing, no meats, no cheeses, nothing that could have meds mixed in, nothing that could have things hidden, nothing. Plain salad twice a day for 5 days. I was convinced they were putting powder from capsules in the air vents, so I would check the air vents every day. And I was convinced they weren't giving me the meds they said they were. So the nurses, bless their hearts, the nurses had to open the meds in front of me. I would not take them unless they opened my pills in front of me. They had to let me examine the package, see what it was, and open it and put it in the cup in front of me before I would take it. And this was 5 days worth. And you take meds 2 to 3 times a day in a facility like that. So this wasn't an easy task, because they've got 20 to 30 patients that they're giving meds to. And my process would take about 10 minutes just for them to show me all my meds and open them in front of me. Because normally what they do is they pour the meds, which means they have them all in a cup already, and you just go to the window, get them, and take them. So I did not make their jobs any easier. And I apologize but I wasn't in my right mind. Another thing I want to touch on, and this is a little different. Something I heard the other day made me think of this. So many people ask me why I talk about my mental health. Why do I not keep it a secret? Why am I so open? And it's like, people with diabetes, people with heart issues, people with, I don't know, stomach issues, people with cancer, they don't hesitate. Most of them, some do, but most of them don't hesitate if they're asked, do you have a health problem? They'll answer the question honestly. So why should I be ashamed of my illness? I'm not sick. My illness is not a sickness. It's simply something I was both born with and developed, being bipolar and borderline. Having bipolar and borderline. I am not my illness. My therapist stressed that to me today when I made that comment. But so many people tell you to snap out of it, or just go outside and enjoy the weather, or meds aren't necessary. I hate that argument that medication is not necessary. For some people, it's not. But just because it's not necessary for you, and you were able to beat your depression by going outside and getting some sunshine, and just because meds made you feel worse, doesn't mean it works for everyone. Just because this cocktail works for me, does not mean it will work for you. And I hate it. I absolutely hate it when people say, your life isn't that bad. Seriously, dude, you don't know what I've gone through in life. I don't know what you've gone through in life. We don't know what the person down the street has gone through in life. What we see on the surface is only what they let us see. So, most people don't know, how do I want to phrase this? I don't know how I want to phrase this without being too obvious, but most people don't know that my first stepdad was an alcoholic. The people I grew up with did. They didn't care. The people in our church didn't care. I grew up in a different church, don't get me wrong. It was not Latter-day Saint. The people in my Baptist church didn't care. And they turned a blind eye to an abusive alcoholic. The people who I go to church with now have no clue about that in my history. They just know I have a new stepdad. I've had him for 10 years. And you know what? He and I don't always see eye to eye, but he loves my mother. He takes care of her. That's all I can ask. And if I don't like what he has to say, I can leave his house and go to my house. I don't have to live with him. So that's our compromise. This video has brought up a lot of memories. Some good, some not so good. I I think about all the times my behavior's been out of control, in and out of the hospital. I think about the times I've been manic. A lot of people don't know that when I get manic, I make very, very foolish choices with regards to my sexual life. I'm not going to go into detail. That is no one's business. But let's just say I've learned my lessons, and now I have safety plans in place for when mania does come, because I easily could have been killed in the past by the choices I made. And it would have been nobody's fault but my own, because, well, obviously it would have been someone else's fault, but I would have played a part in it because I didn't establish boundaries. Boundaries I have an extremely hard time with, although I am getting better. My therapist, my friends, my roommate, my doctor all say that I have gotten much better at asserting myself and saying what I think and doing what I think. Last week, when we were out for my birthday and Becky's birthday, Becky asked me a question. She's like, what are you going to do if so-and-so doesn't like it? I'm like, I don't care if she doesn't like it. It's my life. She doesn't pay my bills, and I'm going to do it because that's what I have to do. A year ago, I never would have said that, especially about this person. She's one of the supports in my life. She's one of my professional supports. And I would have been too afraid to. But now, after spending 6 months thinking I was going to lose my mom at any point, after nearly losing her in December, after seeing my nephews being pulled back and forth in a massive game of tug of war like two little pawns, and seeing what they've gone through and how resilient they are, and after seeing that I can do it, I have made it through so much. Yes, I've needed some medication adjustments. Yes, I've needed some therapy. Yes, I've needed midnight calls to supports because I couldn't quit crying. But I never went to the ER. I never said I was ready to give up. I simply said, help me, because I don't want to give up. And that's the difference. Never give up. It is not worth it. I have friends who've lost people to suicide. I have a friend who lost her cousin. I've lost distant family members to it. I haven't known them, but I know that it leaves a hole, because any death does. Unplanned, planned, anticipated, it leaves a hole. And suicide just leaves questions. It hurts the ones who are left behind because, they wonder what they did wrong, what they could have done, what they missed, and they're going to be blaming themselves for the rest of their lives. Whereas if someone dies from cancer, there was nothing you could do. There's nothing you can do if someone takes their own life. But you're still going to wonder what I could have done, because ultimately it is their choice. But I'm not at that point. I am not anywhere near that point. Let me just state that. I am happy. We got good news today from the cancer doctor. I'm not going to go into it because that's my mother's business. Excuse me. and my YouTube channel is not the place for it. And I think I'm going to head to bed because it is getting late, and I've been talking for over a half hour now and not really getting much progress done on my whip. But I wanted to finish it tonight, but that's not going to happen. Maybe tomorrow. But anyways, I hope you all enjoy this. If you have any comments or questions, let me know. If you disagree with what I said, let me know. I would love to get your input. I would love to hear any stories you might have if you ever spent any time in an inpatient facility and have stories to share. I'm sure we can swap them. But I hope you have a good night. I hope you all... I don't know how I want to say this. I hope you all just make sure you're doing your self-care. It's something my therapist stresses. Make sure that you are doing something good for yourself each day, because if you don't look out for yourself, nobody else will. Okay, good night.